found Mobile Directory very easy to use. The technology was very simple, it was easy to navigate through, and it was no harder than using a mobile phone or the internet.
Mobile Directory, has changed how we work as a service, and myself as a paramedic. In the times gone by, it was a case of you rang an ambulance and we would take you to the hospital. And the nearest hospital at that. Now we have specialist hospitals which perhaps are further afield but have the specialist doctors and the services that you may require. There are specialist hospitals for cardiacs, for strokes, for trauma, and the directory allows us to access this and know where the best place to go with those patients. It also allows us to access community services like psychiatric help, social care. So as a paramedic, the emphasis really is now about treating the patient appropriately within the community if possible and appropriate. And knowing what services are available allows us to do that.
Mobile Directory has a number of benefits to the patient themselves. It allows them to be involved in their own care. They can see the process that is going to happen to them. It also allows us to take them to the right place the first time, rather than us taking them to accident and emergency for them to be transferred at a later date. We're preventing this from happening and getting them the right treatment immediately.
Using Mobile Directory gives me as a paramedic a whole range of benefits. It enables me to work out what services are available in the local community. It enables me to do that on site with the patient rather than having to contact the control centre or specialist paramedics on the urgent care desk, which is what previously we've had to do. This obviously reduces their workload and allows them to focus on the needs that they already have to do with their own job. It also enables the patient to receive the most appropriate care in the right place at the right time.
When you're with a patient, using my Mobile Directory is very easy. We can get the patient involved with their own care. They can see the facilities available in their community. A lot of patients ring us and expect just to be taken to accident and emergency. We are showing them other options, we are showing them what's available, and they can be involved in that whole process.
I'd say the biggest advantage is to the patient themselves, being able to treat them appropriately in the community. The only way to know that is through the directory. In the past, paramedics on scene with a patient would have to ring up the control centre or speak to specialist paramedics on the urgent care desk to inquire as to what services were available. This obviously cuts out all of that, and so it enables the paramedic on site with the patient to do it direct, which obviously reduces the workload of those other people as well.